meaning no simple taking in of that Gatorade or that Powerade. Okay? These are situations where the body is sick. All right? Usually what's going to happen is the heart is going to be unable to pump enough blood to meet the needs of the body. The body is going to go into shock. If the situation is not corrected, the person can die. So this is one of the things they pay a lot of attention to. Now, with hypovolemia, note where we're losing the salt. It is lost from my extracellular fluid only. Meaning, it is lost from the fluid around my cells. This puts these cells in a situation that is no longer isotonic. When you put the cells of the body in a situation that is no longer isotonic, they are going to die. So this is a very serious situation, and you will see this in your clinicals and as you move forward into your chosen field. Dehydration, they are not the same. Dehydration, hypovolemia are not the same. With dehydration, there's a negative water balance. The body is basically eliminating more water than sodium. It affects my extracellular fluid, but also because of the situation that it puts the cells in, the cells lose intracellular fluid. So now I've got a situation where both the cell itself as well as the extracellular fluid are now affected. This is a serious problem for the elderly and the bedridden. People who have to ask for their fluid intake. Okay? This is going to be an issue because there may not be someone always available to provide them with the water that they need, or the person may not care about getting that to the elderly or the bedridden. Other causes that could lead to dehydration, diabetes mellitus. Because diabetes is so prevalent in the U.S., your chances of encountering a patient are very great. Here's the issue. Even in looking at this information right here, the treatments to someone for these issues who don't have diabetes, okay, if you have to treat someone with diabetes, you got to rethink everything. It is not the same. Treating a person with diabetes for dehydration becomes a whole different ballgame than treating someone with just dehydration. Okay? This is one of the things that when you get ready to start moving into studies that you're going to go into, you're going to encounter in almost every single case study that they give you to study is the diabetes. How does the diabetes affect this diagnosis? Because it's not the same. When ADH is hyposecreted, this is termed diabetes insipidus. We mentioned this. And it's where the person is not dealing with sugar or anything, it's strictly their ADH. And they can put out up to 20 or more liters of urine per day. Okay? They have to be treated for that. Profuse sweating, overuse of diuretics, these are the biggest causes for dehydration. Now, here's an issue that comes along with dehydration. Infants are more vulnerable. So if you are in a situation where, I don't know, maybe you're an ER nurse, maybe you're NICU, maybe you're on the peds floor, whatever the case might be, you're going to come across infants who are suffering from, for example, diarrhea, throwing up. If they become dehydrated, they are more vulnerable to death because, one, they have a high metabolic rate. Their production of toxic waste is greater than that of an adult or a child. Their kidneys are not mature, and they cannot effectively concentrate their urine yet. And their body surface, the ratio of body surface to volume, there's no equality there. Okay? Itty bitty baby, lots of fluid, they're losing it. They're going to be losing more than it would affect an adult. It becomes a very serious issue for infants. Lots of stuff like the Pedialyte and everything.
You know, if you're like the charge nurse in the ER, and you'll have an infant come in who, at that point in time, seems like they're okay, but then all of a sudden they decompensate like that.
Yeah.
You know, it becomes a big emergency.
Because their bodies, they can't handle it.
They can't regulate it.
Yeah, because babies, you know, when babies are born, they're roughly 90% water. And they stay a huge volume of water until reaching close to puberty and stuff, okay? Because they're still growing, they still got the cells doing everything. So infants are definitely more vulnerable. Children are a little more. Adults, not so much. Elderly, yes. It's like this cycle that goes around. We find that extracellular fluid, intracellular fluid, blood, everything loses water. The most serious consequences of dehydration, circulatory shock, the heart, blood movement, neurological dysfunction. When people get severely dehydrated, they tend to get disoriented. They may not know their name. They may not know where they are. And so these are good signs and symptoms to help you know, well, maybe they are under dehydration. And we need to check that. The other parts about our fluid balance, fluid excess, meaning more in the body, that's not as common, okay? Mainly because our kidneys will just simply create more urine. We'll just have to go to the bathroom more often. However, in patients who have renal failure, it's the opposite. They are not going to be able to get rid of that fluid on their body, that excess fluid. The most serious effects, it can lead to pulmonary edema, buildup of the fluid on the lungs, meaning it could actually stop the lung function, and then of course cerebral edema, fluid on the brain, both of which can lead to death. In the case of renal failure, the patient in the end stages, okay, of the renal failure, this is what's going to happen. Any of the fluid that is in their body is going to build up in all of their tissues. And by the time death happens, they're very swollen because there was nowhere for all the fluid to go. Now, sometimes fluid can accumulate in a particular region of the body. This would be called fluid sequestration because it's sequestered into one area. Causes are edema, basically fluid left behind in the tissues. In the case of hemorrhaging, where the body's trying to replace the fluid to that area where the fluid loss is being taken place at the wound. And then, of course, the lungs. The lungs are very susceptible to a buildup of fluid on them. And there are different things that can contribute to that, and the issue does need to be addressed. Now, the second part of the chapter, the reason that I put this in, we've talked about every single one of these electrolytes. But what I want you to kind of get an idea of is the terms that are associated and what can happen to the patient. Now, like I said, sodium and chlorine, okay? Sodium is a major effector of affecting fluid in the body. So is chlorine. But sodium, probably one of the biggest. So we have the situations of either too much or too little, hyper or hypo. In the case of sodium, it ends with natremia. You are going to be expected to know what these terms mean. They will be written on the charts. So in the case of hypernatremia, usually the patient has retained water, their blood pressure may be up, they may be swelling in certain areas. The problem with that, it affects muscle, nerves, and can lead to death. Any of these can lead to death. Hyponatremia, not enough. Well, usually that's corrected by the kidneys. Not quite as common. But if it does show up, like in a person with renal failure and so forth, the issue does need to be addressed. Potassium. Now, these two right here, sodium, potassium, how do you remember them being used at the cellular level?
The gates.
Do you happen to, the what?
The sodium potassium.
My sodium potassium pump. What is the importance of that sodium potassium pump working correctly? These two are the major contributors to the balance between the cells and the extracellular fluid. If you remember, sodium is in high concentration outside the cell. Potassiums are usually more inside the cell, but they're getting to move back and forth relatively easy, helping maintain isotonic conditions. And this is what we need to keep these cells in. The cells need to be in isotonic conditions. So, in the case of either one being incorrect, it's going to affect the activity of the cell overall. In the case of potassium, whenever we see a rise in potassium, we get the secretion of aldosterone. Do you happen to remember where that's secreted from? We just talked about it in the